Welcome to the deep dive. You've brought us quite a collection here, articles, research, notes, all centering on patellar luxation in dogs and cats too.
That's right.
So our goal today is to really dig into this material, pull out the key takeaways, and give you a solid understanding of this condition. You know, what it is, why it happens, how vets spot it, treatment options, and, well, the outlook.
Exactly. We'll sift through these sources together. They cover everything from the definition right through to prognosis. So it should give you a pretty comprehensive view. It's definitely more complex than just a kneecap popping out.
Okay, let's start right there then, the definition.
Sure.
What exactly is patellar luxation according to this material?
So at its core, it's when the patella that's the kneecap slips out of its normal groove on the end of the femur, the thigh bone. That groove is called the femoral trochlea.
And it can slip inwards or outward.
Correct. Towards the inside is medial luxation. Towards the outside is lateral. Think of it like a train car that's meant to stay on its track.
Mhm.
Luxation is when that train car derails, basically, off the inside or the outside edge.
And the sources say this is pretty common in dogs.
Oh, yeah, it's one of the most common knee or stifle, technically, problems we see in dogs, less so in cats. But some of this research suggests it might actually be underdiagnosed in cats.
Why is that?
Well, because many cats with it just don't show that obvious limp, you know. They're good at compensating.
Interesting. So it's a structural issue, the kneecap not tracking right. And you mentioned it's not just one thing. There's a range of severity.
Absolutely. And that's really crucial. It's where the grading system comes in, helps us understand the impact.
Right, the grade 1 to 5E system.
Exactly. It classifies the luxation based on how easily the patella pops out, and maybe more importantly, how much the underlying structure of the leg is changed.
And those changes can be pretty significant according to these notes. Things like, well, the tibia twisting.
Yeah, the lower leg bone can rotate. You might see bowing in the femur or the tibia. That groove, the trochlea, it can become really shallow or almost non-existent in severe cases.
Wow.
And there can be issues with the growth plates, and the whole thigh muscle group, the quadriceps, gets pulled off kilter because its attachment point, the patella, isn't where it should be.
That makes sense. And the material highlights a couple of key stats here. Most cases are medial, towards the inside.
That's right, over 75%.
Yeah.
And it's actually pretty common for both knees to be affected. Something like 50% of cases are bilateral.
Good to know. So who gets this? Are certain animals more prone?
Well, it's overwhelmingly dogs.
Yeah.
And within dogs, there's a really strong tendency towards the toy and miniature breeds.
Like which ones? The sources list a few.
Yeah, miniature and toy poodles are classic examples.
Mm.
Yorkshire Terriers, Pomeranians, Pekingese, Chihuahuas, Boston Terriers. Those sorts of breeds pop up again and again in the research.
So if you have one of those little guys, it's something to be aware of early on.
Definitely. You might see signs pretty young, but typically they become noticeable after, say, 4 months old. Oh, and there's a slight sex difference noted, too. Females seem to be about 1.5 times more likely to have it than males.
Huh. And cats. Still uncommon.
Still uncommon, yeah. And often missed, like we said, because they might not limp noticeably.
Okay, so moving from the who to the what. What might an owner actually see? What are the signs?
Well, what you actually observe really depends on a few things. The grade, obviously, but also whether there's already arthritis or degenerative joint disease, DJD, setting in.
Right.
And how long it's been going on, and if there are other knee problems happening at the same time, like a ligament tear.
So what might the owner notice over time? What's the history usually like?
In really young pups, it might just be a general sort of oddness in how they carry or use a back leg. Nothing dramatic, just not quite right. In young to mature dogs, the classic sign is that intermittent skip or hop. You know, they'll be running along fine, then suddenly carry the leg for a step or two, maybe shake it, then put it down again.
Right, I've seen dogs do that.
Yeah, it's very characteristic. And that skipping can get worse over time. Then in older animals, you might see sudden lameness, maybe after just a minor stumble or just because the background arthritis is getting worse.
And how does the vet confirm it during an exam? You mentioned palpation.
Exactly. A vet can feel the kneecap's position and how it moves. That's how the grading happens.
Can you walk us through the grades based on the exam?
Sure. Grade 1, the kneecap's usually in place, but the vet can push it out. As soon as they let go, though, pop. It goes right back in on its own.
Okay. Minimal signs then, usually.
Often, yeah. Grade 2,
Ah.
the kneecap might pop out on its own when the dog bends its knee, or the vet can push it out. But this time it stays out until it's manually put back, or the dog actively straightens its leg and it snaps back in.
And that's where you see the skipping.
That's the classic grade for the intermittent skipping lameness, yes. Grade 3. Now, the kneecap is actually out of the groove most of the time. The vet can usually push it back in, but often only if they straighten the leg right out.
And then it pops out again?
As soon as the knee bends or moves, yeah, it tends to reluxate immediately. These dogs often have more consistent lameness.
And grade 4.
Grade 4, it's permanently out. You just can't manually push it back into the groove at all. And by this stage, you often see those significant bony changes we talked about, like rotation.
Wow, that sounds really debilitating. And for grades 3 and 4, the sources mention you might actually see the leg looks different.
You might, yeah, the dog might have a sort of crouched stance. Or if it's medial luxation, the common type, they can look bow-leg. The technical term is genuvarum.
Okay.
If it's the rarer lateral luxation, they can look knock-kneed or genuvalgum. And in really bad cases, they might shift most of their weight forward onto the front legs.
Is it painful?
It can be. Often the pain is associated with the kneecap actually moving, popping back in or out. Or if there's significant cartilage wear, that exposed bone can be painful. It's not necessarily hurting all the time while it's just sitting out of place, though.
Right. So why does this actually happen? What are the underlying causes?
The sources are really clear on this. The main cause is congenital. It's developmental.
Meaning they're born with the tendency for it?
Exactly. They're born with underlying anatomical abnormalities, the shallow groove, maybe misalignment of the bones or muscles that set them up for the kneecap to slip out. Direct trauma, like a bad fall, is a really rare cause in comparison.
So it's not usually caused by like too much running or jumping as a puppy?
Not usually, no. Though, a minor injury could certainly make a mild, maybe previously unnoticed luxation suddenly become obvious or painful.
Gotcha. And the sources mention a specific factor, coxivara.
Yeah, that's an issue with the angle of the femur, the thigh bone, up near the hip. It can effectively change the direction the big quadriceps muscle pulls, making it pull the kneecap inwards, towards the medial side.
And this congenital basis links back to the breeds, right? It's genetic.
It certainly seems to be. Genetics definitely play a big role. The research papers talk about possible inheritance patterns. Sounds like it's complex, probably multiple genes involved, what they call polygenic. It's even noted as hereditary in Devon Rex cats specifically, which really highlights why responsible breeding is so important.
Absolutely. So how do vets nail the diagnosis?
Well, it really hinges on the clinical signs the owner describes, and then, crucially, the physical exam, that hands-on manipulation of the stifle joint.
Feeling the kneecap move.
Exactly. Feeling its position, seeing if it moves in and out of the groove as the knee is flexed and extended, and testing if it can be manually luxated, or if it's already out, if it can be put back in. That usually tells the story.
What about x-rays or CT scans?
They definitely have a role, especially for the higher grades, like 3 and 4. But often, their main job is to show the extent of the bony changes, that bowing or twisting we talked about.
Right, to help plan surgery, maybe?
Precisely, to assess the overall alignment and deformity. The actual luxation itself is usually pretty obvious just from the physical exam.
Okay. And are there other things that could cause similar symptoms? Other knee problems?
Yeah, differential diagnoses are important. The sources list a few things to rule out. A big one is cranial cruciate ligament rupture. The dog equivalent of an ACL tear.
Is that common alongside luxation?
It can be. The sources say about 15–20% of dogs with patellar luxation also have cruciate issues or develop them later.
Wow. What else?
Things like the patellar tendon tearing or pulling off the bone, which makes the kneecap sit too high, or maybe issues from old leg fractures that healed crooked, pulling the whole mechanism out of line.
Okay. Let's think about what's actually going on inside the joint. What kind of damage happens over time?
Well, if you could look directly at the joint surfaces, you'd often see signs of wear and tear. The cartilage on the back of the patella and in the trochlear groove gets worn down from rubbing incorrectly.
Like arthritis starting.
Essentially, yes. The joint capsule, the lining around the joint, can also change. It might get stretched out on the side opposite the luxation and kind of thick and contracted on the side towards which the patella is luxating.
And under the microscope.
You'd see evidence of cartilage damage like fibrillation, where the surface gets rough and frayed, and signs of inflammation in the joint lining, synovitis. It's all part of that chronic irritation and the osteoarthritis process.
Right. So let's shift to treatment. What can actually be done about this?
The right approach really depends on the grade and how much it's bothering the animal.
So not always surgery.
Not always. For grade 4, and maybe some grade 2 cases where the dog isn't showing many signs, conservative management might be okay. That means things like keeping them at a healthy weight, maybe restricting really strenuous activity, perhaps using joint supplements or pain meds if needed.
But for more severe cases.
For most grade 2s that are causing that obvious skipping or lameness, and definitely for all grade 3 and 4 luxations, surgery is usually recommended. That's considered inpatient care.
Okay. And if they do have surgery, what's the immediate aftercare like?
Post-op, the focus is on comfort and reducing swelling. The sources mention cryotherapy, ice packing the knee for, say, 5–10 minutes, a few times a day for the first few days,
Yeah.
and gentle, passive range of motion exercises. Just bending and straightening the knee carefully as soon as the patient can tolerate it. Helps keep things moving.
And activity. Strict rest.
Yeah, definitely restricted activity after surgery. Usually involves short, controlled leash walks, only for several weeks. No jumping, no rough play. That's crucial for healing.
And weight control is important whether they have surgery or not.
Absolutely critical. Less weight means less stress on that whole kneecap mechanism.
Yeah.
Probably one of the most important conservative things you can do.
Makes sense. Okay, this leads to what owners really need to know. What are the key takeaways from these sources for someone whose pet has this?
Several really important points. First, reinforcing that it's often hereditary. It runs in families, especially in those predisposed breeds.
Which has implications for breeding, right?
Exactly. Responsible breeders should ideally screen for this. The advice is generally not to breed affected animals, and certainly not to repeat a breeding pair that has produced puppies with patellar luxation.
What else should owners know, especially about surgery?
They need realistic expectations. Surgery is often very successful, don't get me wrong. But the sources give actual numbers showing that relapse, the kneecap starting to pop out again, can happen.
What kind of numbers are we talking about?
The figures vary a bit between studies, but somewhere in the range of 8% up to nearly 20% might experience some degree of reluxation after surgery.
That's not insignificant.
No, and maybe around 13% might need a second revision surgery later on. So while the odds are good, it's not a 100% guarantee. Owners also need to know about that increased risk of cruciate ligament problems down the road, even after the luxation is fixed.
Okay.
And finally, that a lower grade luxation isn't necessarily static. A grade I could potentially worsen and become a grade 2 over time.
That's a really good overview of the owner considerations. Let's dig into the surgery itself a bit more. What's the main goal?
The fundamental goal is to correct the underlying malalignment, to get the kneecap tracking properly in that femoral groove again.
And how do they do that? The sources mention several techniques.
Yeah, it's often a combination of procedures tailored to what's wrong in that specific knee. One of the mainstays is called tibial crest transposition.
What does that involve?
That addresses the attachment point of the patellar tendon down on the tibia. The surgeon basically cuts that bony bump, the tibial crest, moves it sideways, usually outwards, for a medial luxation to straighten the pull of the tendon, and then fixes it in the new position with pins or wires.
So, realigning the lower anchor point. What about the groove itself, if it's too shallow?
Right, that's another common issue. So, procedures called sulcoplasty are used to deepen the groove, the sulcus.
How do they deepen it?
It could be as simple as just rasping or burring away some bone, but more sophisticated techniques involve removing a wedge or a block of the existing cartilage and bone from the groove, deepening the channel underneath, and then putting that wedge or block back in. That way you preserve the smooth cartilage surface while making the track deeper. The block technique is maybe preferred now as it gives more contact area.
Clever. So, deepen the track, realign the pull. What else?
Addressing the soft tissues is important too. If the joint capsule and tissues on the side of the luxation are really tight, they need to be released. That's a capsulotomy.
Cutting them to relieve tension.
Exactly. And conversely, the stretched out tissues on the other side can be tightened up, imbricated. But the sources stress that tightening alone usually isn't enough for a permanent fix.
Right. Need to fix the bone alignment.
Precisely. And in the really severe grade 4 cases, where the femur or tibia itself is significantly bowed or twisted, they might need to do corrective osteotomies.
Meaning cutting and straightening the main bones.
Yes, cutting the bone, realigning the limb axis, and fixing it with plates or other implants. That's obviously a more complex procedure for severe deformities.
Sounds like a very tailored approach. What about medications around surgery time? Pain relief.
Yeah, post-op pain management is key. The sources list NSAIDs, non-steroidal anti-inflammatory drugs as the usual go-to.
Like meloxicam, carprofen.
Exactly those. Meloxicam, carprofen, idodolac, daracoxib are mentioned, usually given for the first week or so after surgery to manage pain and inflammation.
Anything to avoid?
Corticosteroids like prednisone. Generally avoided because of side effects and potential harm to joint cartilage with long-term use.
And any warnings about the NSAIDs?
Just the usual precaution that they can sometimes cause stomach upset or irritation in some animals.
Okay. What about supplements? Glucosamine, fish oils?
Fish oils, the omega-3 fatty acids, get a mention as potentially helpful for reducing joint inflammation.
And glucosamine achondroitin. Lots of people use those.
They do. The sources acknowledge they're widely used, but also note that recent evidence suggests they might have minimal effect on actually preventing further cartilage damage.
So maybe some comfort, but not fixing the underlying issue.
That seems to be the current thinking reflected here. They might provide some symptomatic relief for some, but probably don't change the course of the arthritis itself much.
Okay. So after the surgery and initial recovery, what's the long-term plan? Follow-up.
Monitoring involves making sure they get back to appropriate activity levels gradually. If the tibial crest wasn't moved, they often encourage using the leg fairly early. If it was moved, then stricter rest is needed until follow-up x-rays confirm that bone piece is healed.
How long is the restricted exercise usually?
Typically leash walks only for about 4 weeks post-op, gradually increasing, still avoiding jumping and hard running for a while longer.
And vet checkups.
Yearly exams are a good idea. Just to check the joint, feel for any signs of the luxation coming back, assess for arthritis progression, or check for those cruciate ligament issues.
Right. And prevention comes back to breeding choices again.
Primarily, yes. Advising owners about the heritability and making informed decisions about breeding affected animals.
Are there common complications after surgery owners should know about?
The sources list a few possibilities. Infection is always a risk with any surgery. Recurrence of the luxation, as we discussed. Sometimes that piece of bone, the tibial crest, can break off before it heals. That's avulsion. Or the pins or wires used to hold it can sometimes migrate or loosen.
Okay, good to be aware of those potentials. So bringing it all together then, what's the bottom line? The expected outcome, the prognosis.
Overall, with surgery, the prognosis for function is actually very good.
Really? Even with those potential complications?
Yeah, the sources state that more than 90% of patients end up doing really well, basically free from significant lameness and able to live normal, active lives.
That's fantastic news for owners facing this.
It really is.
Yeah.
But there's an important caveat, or maybe just a nuance, that comes through strongly in the material.
What's that?
While the dogs function well, radiographic evidence of arthritis DJD develops in almost all of these knees after surgery.
So the x-rays still show arthritis even if the dog seems fine?
Pretty much, yes. The joint doesn't look perfectly normal on an x-ray down the line. But, and this is key, the sources suggest that for most small dogs, the clinical significance of this radiographic arthritis seems minimal.
Meaning it doesn't cause them much pain or lameness day to day.
Exactly. It seems like fixing the mechanics, stopping the kneecap from constantly popping out, dramatically improves their comfort and function, even if the joint still shows some wear and tear on imaging. The alignment is key for quality of life.
Well, this has been a really thorough deep dive into the sources you brought. We've covered a lot from the basic definition and that crucial grading system
To the underlying bony and soft tissue issues that actually cause it.
the different surgical techniques tailored to fix their specific problems, and some really important points for owners about genetics, outcomes, and potential risks.
Yeah, understanding how it all connects, the cause that changes the repairs, gives a much richer picture, doesn't it, than just thinking slipping kneecap.
It absolutely does. And it leaves us with that interesting final thought right from the material we've been discussing. Isn't it fascinating that surgery is so successful functionally, getting over 90% of these dogs back to normal activity? Yet, radiographically, almost all the joints still develop signs of arthritis.
Yeah, it really makes you think, doesn't it,
I think
about the
so.
difference between mechanical stability and sort of the long-term biological health of the joint tissues themselves.
A powerful reminder, like you said, that fixing the mechanics might not completely erase the joint's history of instability, something definitely to mull over.
Indeed.
Thank you so much for sharing these sources and walking us through them. This has been incredibly informative.